Welcome to our comprehensive exploration of type 2 diabetes mellitus, a condition that affects millions globally. In this video, we will delve into the intricacies of diabetes management, from understanding the underlying mechanisms to exploring effective treatment strategies. Type 2 diabetes is characterized by high blood sugar levels due to insulin resistance and insufficient insulin production. It is crucial to grasp these concepts, as they lay the foundation for effective management and prevention. Throughout this video, we will cover topics such as insulin resistance, beta cell dysfunction, and the role of lifestyle modifications. Additionally, we will examine the impact of medications like metformin and SGLT2 inhibitors, as well as the importance of patient-centered care. By the end of this video, you will have a clearer understanding of how to manage and potentially prevent type 2 diabetes, improving patient outcomes and quality of life. Now that we have set the stage, let us begin by exploring the fundamental aspects of type 2 diabetes and its global significance. Type 2 diabetes mellitus is a chronic metabolic disorder characterized by high blood sugar levels due to insulin resistance and a relative lack of insulin. It is one of the most prevalent health conditions globally, significantly influenced by factors like obesity and a sedentary lifestyle. Unlike type 1 diabetes, which is an autoimmune condition, type 2 is primarily related to lifestyle and genetic factors. Understanding these distinctions is crucial for effective management and prevention strategies. As we explore the mechanisms of type 2 diabetes, we will focus on the role of insulin resistance and how it contributes to elevated blood sugar levels. This foundational knowledge will help us understand the importance of lifestyle changes and medical interventions in managing this condition. Now that we understand the basic definition and significance of type 2 diabetes, let us delve deeper into the concept of insulin resistance and its impact on the body. Insulin resistance occurs when the body's tissues become less responsive to insulin, leading to impaired glucose uptake and elevated blood sugar levels. This condition is a precursor to type 2 diabetes and is often identified by signs like acanthosis nigricans and elevated fasting glucose. Managing insulin resistance involves lifestyle changes such as weight reduction and increased physical activity, which are essential to prevent the progression to full-blown diabetes. By improving insulin sensitivity, individuals can better regulate their blood sugar levels and reduce the risk of developing diabetes-related complications. Understanding the mechanisms of insulin resistance is crucial for healthcare providers and patients alike, as it informs treatment strategies and lifestyle recommendations. With this foundation in place, we can move on to examining the role of beta cell dysfunction in the progression of type 2 diabetes. Beta cell dysfunction refers to the progressive failure of pancreatic beta cells to secrete adequate insulin, resulting in elevated blood glucose levels. This dysfunction is a critical factor in the progression of type 2 diabetes, as it exacerbates the effects of insulin resistance. Understanding this process helps in making informed decisions about treatment options, including medications that preserve beta cell function and the potential need for insulin therapy. By addressing beta cell dysfunction early, healthcare providers can tailor treatment plans to individual needs, improving patient outcomes and quality of life. As we continue our exploration, it is important to recognize the role of adipokines in regulating insulin sensitivity and their potential as therapeutic targets. This brings us to one of the most important aspects of our topic. Let us take a closer look at adipokines and their influence on diabetes management. Adipokines are proteins secreted by adipose tissue that play a significant role in regulating insulin sensitivity. Notable adipokines include adiponectin and leptin, which influence metabolic processes and the interplay between obesity and diabetes. Research into adipokines holds potential for developing targeted therapies to enhance insulin sensitivity and manage diabetes more effectively. By understanding the role of these proteins, healthcare providers can better address the underlying causes of insulin resistance and tailor treatment plans to individual patients. As we explore the impact of adipokines, it is essential to consider how glycemic criteria are used to diagnose diabetes and guide treatment decisions. Now that we have explored the role of adipokines, let us examine the glycemic criteria used to diagnose diabetes and their importance in patient management. Glycemic criteria are essential standards used to diagnose diabetes, based on blood glucose levels and HbA1c percentages. Accurate diagnosis using these criteria is crucial for effective patient management and long-term outcomes. Understanding these standards helps healthcare providers confirm diagnoses and tailor treatment plans to prevent complications and improve patient quality of life. By adhering to these criteria, clinicians can ensure that patients receive appropriate care and interventions. As we continue our exploration of diabetes management, it is important to recognize the role of medications like metformin in controlling blood sugar levels. With this understanding of glycemic criteria in place, let us delve into the role of metformin and its impact on diabetes management. Metformin is a widely prescribed medication for type 2 diabetes, known for reducing hepatic glucose production and improving insulin sensitivity. Its effectiveness and tolerability make it a preferred first-line therapy, helping to manage blood sugar levels while minimizing side effects. Patient adherence to metformin is crucial, as it significantly impacts treatment outcomes and overall diabetes management. Understanding the mechanisms of metformin and its benefits allows healthcare providers to make informed decisions about patient care. As we explore the role of medications in diabetes management, it is important to consider the impact of microvascular complications and the need for regular screening and intervention. Now that we have discussed metformin, let us examine the impact of microvascular complications and their management in diabetes care. Microvascular complications arise from diabetes-related damage to small blood vessels, leading to conditions such as retinopathy, nephropathy, and neuropathy. These complications significantly impact quality of life and require regular screening and early intervention to prevent irreversible damage. Effective glycemic control and comprehensive management strategies are vital in mitigating these risks. By understanding the mechanisms of microvascular complications, healthcare providers can develop targeted interventions to preserve patient health and well-being. As we continue our exploration, it is important to recognize the role of macrovascular complications and their impact on cardiovascular health. With this understanding of microvascular complications, let us explore the impact of macrovascular complications and their management in diabetes care. Macrovascular complications involve damage to large blood vessels, increasing the risk of serious conditions like myocardial infarction and stroke. These complications are a leading cause of morbidity and mortality among diabetes patients. Developing comprehensive management plans that include lifestyle changes and appropriate medications is essential for reducing cardiovascular risk and improving patient outcomes. By understanding the mechanisms of macrovascular complications, healthcare providers can develop targeted interventions to preserve patient health and well-being. As we continue our exploration, it is important to recognize the role of lifestyle modification in diabetes management and its impact on patient outcomes. Now that we have discussed macrovascular complications, let us explore the role of lifestyle modification in diabetes management and its impact on patient outcomes. Lifestyle modification is a cornerstone of diabetes management, involving changes in diet, physical activity, and weight management. These adjustments empower patients to take control of their health, leading to improved adherence and outcomes. Personalized lifestyle plans that focus on achievable dietary changes and exercise routines are crucial for long-term success and disease control. By understanding the importance of lifestyle modification, healthcare providers can develop targeted interventions to preserve patient health and well-being. With this understanding of lifestyle modification, let us explore the role of SGLT2 inhibitors and their impact on diabetes management. SGLT2 inhibitors are a class of medications that promote urinary glucose excretion, offering additional cardiovascular and renal benefits beyond glucose control. These medications are particularly beneficial for patients with type 2 diabetes and cardiovascular disease, providing a comprehensive approach to managing multiple health concerns. Understanding their mechanism of action and potential side effects is important for optimizing patient care. By incorporating SGLT2 inhibitors into treatment plans, healthcare providers can enhance patient outcomes and quality of life. As we continue our exploration, it is important to recognize the role of patient-centered care in diabetes management and its impact on patient outcomes. Now that we have discussed SGLT2 inhibitors, let us explore the role of patient-centered care in diabetes management and its impact on patient outcomes. Patient-centered care is essential in diabetes management, focusing on understanding patient perspectives and challenges in daily life. By developing individualized care plans that emphasize diet, exercise, and medication adherence, healthcare providers can enhance patient engagement and outcomes. This approach fosters a collaborative relationship, empowering patients to actively participate in their healthcare journey. By understanding the importance of patient-centered care, healthcare providers can develop targeted interventions to preserve patient health and well-being. As we continue our exploration, it is important to recognize the role of effective learning strategies in diabetes management and their impact on patient outcomes. With this understanding of patient-centered care, let us explore the role of effective learning strategies in diabetes management and their impact on patient outcomes. Effective learning strategies for diabetes management include focusing on understanding the pathophysiology and management strategies, such as lifestyle changes and pharmacological interventions. Common pitfalls include overlooking the importance of lifestyle modifications. Utilizing resources like the American Diabetes Association guidelines and endocrinology textbooks can enhance comprehension and application of knowledge in clinical practice. By understanding the importance of effective learning strategies, healthcare providers can develop targeted interventions to preserve patient health and well-being. As we conclude our exploration, it is important to recognize the role of ongoing education and support in diabetes management and their impact on patient outcomes. With this understanding of effective learning strategies, let us summarize the key points and conclude our exploration of diabetes management. In conclusion, we have explored the complexities of type 2 diabetes mellitus, from understanding insulin resistance and beta cell dysfunction to examining the role of lifestyle modifications and medications. By grasping these concepts, healthcare providers and patients can develop effective management strategies that improve outcomes and quality of life. We have also highlighted the importance of patient-centered care and ongoing education in empowering individuals to take control of their health. As you continue your journey in understanding and managing diabetes, remember that knowledge and collaboration are key to success. Thank you for joining us in this exploration, and we hope you feel better equipped to navigate the challenges of diabetes management with confidence and clarity.